Let's next queer up LGBTQ plus students and youth culture. Major study finds anti-LGBTQ plus policies have an alarming effect on youth mental health. Alarming statistics released this week by the Trevor Project, a national suicide prevention organization, reveal that nearly 40% of the LGBTQ plus youth in the United States have seriously considered suicide in the past year. This data stems from a survey conducted among over 18,500 individuals aged 13 to 24 between September and December of 2023. The findings shed light on the mental health challenges faced by queer youth, especially in an environment where over 480 anti-LGBTQ plus bills have been introduced across the nation. This survey supplemented the Centers for Disease Control and Prevention's Youth Risk Behavior Survey released last year. The CDC data stated that feelings of sadness or hopelessness were reported by LGBTQ plus youth at the rate of 69%, as compared to heterosexual students at 35%. Restated, LGBTQ plus youth are twice as likely to feel sadness and hopelessness. Dr. Ronita Nath, Vice President of Research at the Trevor Project, underscores the need for supportive communities among the recent political developments that have negatively affected the well-being of a staggering 90% of all study youth respondents. Instances of physical threats, bullying, discrimination, and conversion therapy have doubled the suicide attempt rates among the affected youth. The 2024 Trevor Project survey comes shortly after the latest report by UCLA School of Law's Williams Institute, which shows that 93% of trans youth aged 13 to 17 are in states where anti-LGBTQ plus bills have been passed or under consideration. The report noted that these growing attacks in America have been launched by radical conservatives and faith-based evangelical organizations. Against such a grim backdrop, Nath urges, and I quote, politicians, members of the media, anyone publicly debating about LGBTQ plus young people to really understand that protecting and supporting the mental health and well-being of young people, you should be up for political debate. Wow, that's a lot to unpack, right? I look at a lot of things when I hear things like this, especially statistics, knowing like when I grew up, and I say that because, I was a child of the 60s. So for me, I look at the stress that we put on our youth today, and I'm not talking because of LGBTQ, of them finding their identity. I'm thinking of the things we impose on them as friends, schools, the workload that we, give them. Both parents in some cases may or may not be working if they have both parents, or they may be working enough that no one's there to take care of the child growing up. And I think the impact that we need to continue to focus on when it comes to mental therapy with our youth is staggering, because I do not believe we have enough healthcare providers out there that can really even come close to touching the service of our youth. It's very disturbing to see the numbers. And I can only see that today it's even more and more challenging. And it's a way for parents to recognize that things are different from when they were a child and when their parents were children. And they need to offer that complete unconditional love and support to find people, find organizations to help this youth generation.
I'm curious, and I really don't know what the answer is. I'm of course the Trevor Project, and I'm familiar with many of the youth advocacy organizations, nonprofits that serve LGBT students. We're broadcasting here at Sunshine. SunServe's program for youth is right upstairs from us. But broadly, in terms of healthcare systems, is issues like what Trevor Project is illustrating, is that something that the healthcare system of the United States is focusing on, the mental health and mental well-being of marginalized communities, LGBT being one? Is the health system focusing on that? I don't really know.
So it's a great question. Excuse me. My husband, Jeff, is a psychotherapist, LCSW, and he works a lot with, he's getting his PhD in sexology, so he does a lot of work in this field. And the rate and incidence of LGBTQ people dying by suicide or attempting suicide, we don't call it committing suicide anymore because it's not a crime, right? It used to be a crime, but it's not anymore. It's staggering. And there's definitely a better focus now. I mean, the Affordable Care Act, for example, also known as Obamacare, really brought to light the importance of insurance coverage for mental health, behavioral health. But it's also a societal issue, right? It's not polite conversation. It's not the niceties like the movie, right? People don't want to talk about it. And
Shame.
So it's shame-based, right? And so these kids who are experiencing this, I mean, listen, I grew up in a Hispanic family in New York. Did I ever think about dying by suicide? Yeah, because I didn't know anyone. I didn't have any role models, right? This is back in also a child of the 60s, 70s, somewhere in that neighborhood, about the same age.
I'm sorry, one more time?
So, the 60s. I grew up in New York. We arrived from Cuba in 66. And, there were really no role models. There was nowhere I could turn as a young man. And I was very blessed that I went to a very progressive Catholic school, ironically, that was run by the Marist brothers. And they had peer group counseling back in the day. And it was there that I was able to explore who I was and not even knowing that I was gay. It was just like I was different. But there were loving people there.
And you didn't know why.
And I didn't know why.
Mm-hmm.
But I had no role models. I couldn't go online and research, openly LGBTQ anything. There were no openly elected leaders. There were no news anchors. There was no Anderson Cooper. There was no Ellen. There was none of that, right? And so I didn't have a place to go. And that's one of the reasons I think it's important for us who are LGBTQ to be open so that kids can see, oh, okay, I can be successful and I can live and I can have a family and I can have a future, which is what we all want, right? I can be loved and have love. The more we do that as openly LGBTQ people and allies, the more we will drive that point home. And I think systemically as a healthcare system, we're doing a better job of identifying behavioral health issues. Even at the university, we have a very big focus at FAU on the mental health of our students. And I take a special understanding of it because of my husband's background and also my personal experiences. And it's interesting because it's hard to talk about. Like if I'll see a kid who's really struggling, I'll pull them aside and just try to have a brief conversation and make a referral. I think more of us in healthcare and in education, frankly, need to do that. That's where it's going to start, is we need to be verbal and let people know it's okay to talk about those things. There's no shame in how you feel, right? It's more about how do we get you to a place of mental health.
Mm-hmm. It reminds me when you make that observation, Harvey Milk in 1978 says the number one obligation that we have is to come out, because if we represent ourselves in the community, that is the greatest, fastest action step that we could have for a community. As it relates to mental health, we're sitting in a state, and many states are sitting in situations where we live in don't say gay environments, and as a result, that has to exacerbate these feelings of isolation and loneliness. Is there a role for medical professionals, healthcare systems, etc., in this environment of what's happening in schools and what's happening in our libraries? And you can't read a book about two male penguins just adopting an egg and making sure it's okay. Are there roles for healthcare or?
Absolutely. Maybe you'll talk a little bit about, but I know recently you were at a college campus locally, and you had a table set out as part of an outreach event, and we had rainbow bags, and they say Holy Cross. And what did the youth say to you?
Oh, so I had 4 students that come running up, and they're like, "Can I have one of those gay bags?" That was the first thing they said. And I was like, of course you can. I was cracking up because the way they were so excited. And so I started talking to them, and I was like, so do you have an LGBTQ plus youth group or a group here at the college? And they're like, we're not allowed to. But we're the Crayola Club. And I was like, oh my gosh.
Isn't that fabulous?
Fabulous. So
the crayon.
The crayon.
All the colors. I know, but all of the colors in the crayon.
And all I could do was just give them my cards and say, call me. You have any problems, I'll connect you. I may not know the answers, but if I don't, I'll find out who does.
You know, we reported just this week the LGBT on-campus center at the University of North Florida 7 days before graduation closed this week. Wow. And presumably many other university LGBT centers will do the same thing in following the rules. That's a lovely story. Glad you shared that. But very specifically, what kind of role, given the stress that's happening to young marginalized students, not just LGBT, but we're focusing on LGBT, what role or what are there action steps? And if they are, what might they be?
Well, education, and as Rudy said, making the whole conversation a norm and not an exception. That it's okay to talk about when you're having a bad day. It's okay to talk about when things aren't going your way. And it's okay to talk about when you don't fit and you don't find fit, and who can I go to speak with? It's real important everybody knows the 988 number, which is a national number, that if you're feeling in crisis, you need someone to talk to, that's your go-to number, 988. Just like you would call 911 for a physical problem, you call 988 for a mental health problem. And locally, you can also call your 211 operators. There are support systems available, whether it's online, by telephone, healthcare practitioners. It can be somebody, if you go to a church, a temple, whomever that trusting person is, to have the conversation and to know that it's okay to reach out. It's okay to ask for help. And we need to normalize that conversation so that people can.
I'm curious, were any of you surprised at Trevor reporting 4 out of every 10 youth between 13 and 23 have thought about suicide in the last year? Does that surprise you? Are you shocked?
No.
It's a pretty well documented, sadly, statistic. To answer your question about what can healthcare providers do, I think one of the biggest responsibilities we have is to bear witness, right? To when we're in front of that patient in the privacy of the exam room, or when they're being talked about to refer somewhere, is being able to normalize that LGBTQ is okay. Whether it's something like wearing I have a name badge, we all do it, Holy Cross, mine has a rainbow stripe on it. Our monitors throughout Holy Cross say hate has no home here, and has, rainbow colored themes.
That's awesome.
The work that Vaughn and Kim and their teams are doing out in the community, whether it's out in the bars, doing monkeypox vaccines in the bars, meeting people where they are and normalizing that it's okay. Here is a safe space. The whole Safe Zone project that Wilton Manors has now with the police department, we're proud to be a part of that at Holy. And I think that, and especially as a faith-based hospital, right? There's a lot, for me I grew up Catholic, there might be sometimes a fear of going into a faith-based hospital because of institutional trauma, right? And so one of the things that we at Holy Cross are very mindful of is to own that and to say, okay, we know this could be an issue. We're going to prove people wrong, right? We're going to say, when you come here, you're going to feel like you're at home. We had a wonderful recent LinkedIn post from a member of the trans community who was in our ED, and she, I think her pronoun is she, not they.
It is.
She just was raving about the experience she had in our emergency room. And that's a credit to the team, because Kim and Vaughn and the team have really worked hard to help educate our folks. And that's the number one takeaway. To the extent that the leadership of an organization makes this a priority and says, we will have a discussion. And look, let's face it, some people aren't going to buy what you're selling, okay? But when it comes to how they officially comport themselves as a representative of our health system and others, there's zero tolerance for anything but total inclusion. And that's where it's going to happen. It's going to happen hospital by hospital, doctor by doctor, provider by provider, therapist by therapist.
Rudy, do you think we'll get there?
Well, I'm an eternal optimist. Do I think we'll get there eventually? Yes. Do I think it's going to be a lot of work? Yes. I think the real question is, must we get there?
Yeah.
And the answer is yes.
Yeah.
We can't afford to have 40% of our kids dying.
And we have to hold people accountable. And we have to take people aside when you overhear a conversation that isn't just, and to say, hey, when you referred to XYZ, that's just not okay. And that's not our values. And look at the hurt that's caused by that. And to really look at it as a learning opportunity, but to call the person out nicely, respectfully, but to let them know it's not okay.
Yeah. You know, to close up our conversation about what's happening to LGBT youth, two quick observations. First, I frequently make the joke, older, privileged, white, gay guy on Wilton Drive, I'm okay, I'll be fine. But that's really not the point. There are so many people that need our help in our community, and this story focuses on that. And because of that, I just want to close by saying very specifically, we thank our advocates in community. We want more healthcare advocates, but organizations like Safe Schools and organizations like Pride Lines and their community center in Miami-Dade County and SunServe, in terms of what they do, they're vitally, vitally needed. And if we only think about ourselves, even in our own community, we're not really helping our entire community.
If I may, I was having dinner, my husband and I were having dinner about a month ago with some older white gay male friends. And we're at Chef Nate's, and they were saying, oh, I don't understand why they, whatever they are, have to have that trans flag over there at Justin Flippin Park. I was shocked, because this is someone who's really intelligent, someone I've known for years. And I'm like, what are you talking about, man? Like, well, that's not our struggle. I'm like, whoa. Okay, remember that if it were not for people of color and trans women and men at Stonewall, you'd still be in the closet married to your wife and doing God knows what on the side. So we have privilege now. We white gay males, I'm Hispanic also, I present as white. And I feel that we have a burden, but a responsibility of speaking truth to that power. And our sisters and brothers who are trans need to know that of all places, they're going to be safe in the greater community.
That's the action step that you just discussed. You took the action step. I love that. Let's stand up for our LGBT youth.